Are some COVID-19 vaccines better than others? In France and Germany, people are taking up the Pfizer shots, but shunning AstraZeneca's offering. Health experts say we shouldn't pick and choose. So who's right? This is Inside Story. Hello and welcome to the programme. I'm Rob Matheson. Now, more countries are approving different COVID-19 vaccines to try to control the pandemic. The drug makers are touting varying levels of protection. For example, Pfizer and Moderna say their shots worked on 95% of the people who received them in a clinical trial, while Oxford AstraZeneca reported about 70%. That has led to a belief that some vaccines are better than others. France's health ministry says only a quarter of the AstraZeneca vaccines it's received have been used. In Germany, 2/3 of its 1.4 million vials are still in storage. Now, some cities say people are cancelling their appointments in favour of Pfizer. But on Monday, France changed its original advice, so those over the age of 65 could receive the AstraZeneca jab. Germany is under pressure to follow suit.
Actually, we should make AstraZeneca available for everyone as quickly as possible and not in 4 or 6 weeks. And every new vaccine on the market should be put into a system to speed up vaccinations. I would make additional doses of AstraZeneca available immediately through general practitioners. No vaccine must be left sitting around in Germany.
Well, some health experts say we should focus on the number of people in hospital and the death toll instead of the so-called effectiveness percent of a particular vaccine. This tweet by the Dean of the Brown University School of Public Health has been shared thousands of times. He says no one who has received a jab in a clinical trial has died or been taken to hospital. Well, real-world studies suggest any vaccine will prevent serious illness. In Scotland, the AstraZeneca jab reduced the number taking up hospital beds by 94%. Israel, which has inoculated the most people per capita, found last month that only 0.04% of those given jabs developed COVID-19. India's health ministry says no deaths have been linked to the vaccine. And in the US, the top infectious disease official is urging all Americans to get whichever vaccine is available.
All three of them are really quite good, and people should take the one that's most available to them. If you go to a place and you have J&J and that's the one that's available now, I would take it. I personally would do the same thing. I think people need to get vaccinated as quickly and as expeditiously as possible. And if I would go to a place where they had J&J, I would have no hesitancy whatsoever to take it.
OK, let's bring in our guests. From Oxford, Samantha Vanderslott is a social science researcher at the Oxford Vaccine Group. In Barcelona, Chettri Lazarus is the head of the Health Systems Research Group at the Barcelona Institute for Global Health. And with us from Gangtok in the Indian state of Sikkim, Deepsikha Chettri is a medical doctor and member of UNESCO's International Bioethics Committee. Welcome to the programme. Thank you very much indeed for being with us. Chettri, there's been a difference, of course, between people hesitating to get the vaccine and people refusing to get the vaccine. But in the short term, the result is pretty much the same. Why is there such public uncertainty about some of these vaccines?
Well, there's a lot of myths circulating. There's also some concerns about the speed in which the vaccines were approved. So we try to explain that the process was able to go quickly for a number of reasons, including a high uptake in participants in the clinical trials, careful oversight, rolling reviews by the regulatory agencies. So there's a as you mentioned, there's a group that's hesitating, but a very much smaller group that's actually refusing to get vaccinated.
Samantha, as I was just talking about there, the media has focused a lot on this so-called efficacy level of vaccines. Experts are saying that we should be looking at the zero or close to zero hospitalizations and the death tolls to judge those vaccines. How much has that influenced the way that the public at large is viewing these vaccines?
I think that's right. The problem is the efficacy levels from the trial are part of the things that get taken away by the public. So if you're looking at different vaccines and comparing them, you have those numbers in mind, and it does lead to the feeling that one vaccine is better than the other. It's just really not the case that you can make these kind of comparisons about trial data. And we know that all of the vaccines that have been approved for emergency use are stopping these hospitalizations, severe illnesses, and death. So they're stopping transmission also. And it really just points to taking the vaccine that's offered to you and not picking and choosing.
Deepsikha, it's not just about what figures you look at, though, is it? Because I understand that in India there was a company called Bioethics. It developed its own vaccine called Covaxin. Now, it was, if I understand it correctly, it was given emergency approval by the government, but there were no details initially given about the effectiveness rates. How much do you think an apparent lack of transparency is contributing to people's suspicion of vaccines?
Yeah, transparency level is, of course, a major determining factor. But then again, even though Bharat Biotech's vaccine was approved for emergency use, it was very elaborately available in the government portals, including the side effects of the Bharat BioShield vaccine, which is Covaxin, and also the second vaccine, which was developed by Serum Institute, which is known as Covishield. I received the Covishield shots. And if you visit the government portal of India, you will see that alongside these two vaccines have been placed along with their side effects. So the transparency level was quite adequate, yes. But to the masses, no. Because I come from such a country where not everybody has access to internet and government portals. So the transparency level is limited only to a certain strata of the society who have access to internet and web portals and that sort of literacy level. But to the masses, no. So yes, this lack of transparency, not exactly, but the lack of propagation of the same is playing a role in the hesitancy of vaccines in India.
Given the fact that almost all the vaccines that are being offered at the moment have, if I understand it correctly, just a couple of months' worth of data that has been provided so they can be put forward for emergency approval. The long-term effects of all these vaccines, we don't really know. Even the pharmaceutical companies don't really know about that. How do you get the public, Deepsikha, to trust an unproven vaccine?
In any medicine, in fact, there are so many medications which have just come into use. Remdesivir, for example, hydrochloroquine and its use in COVID. We do not know the long-term effects. But in health and in medicine, what we do is we always weigh the pros and the cons. And at this juncture, the pros of the vaccine are definitely much, much, much more than the cons. It is obviously better to take a shot at protecting ourselves from COVID than dying from it. So I feel we as healthcare workers should lead by example, and we should educate the public as much as possible about the trials that have been done, about the side effects so far, as much as we know, because knowledge is the best counter for fear. That is what I believe. So, we can give them as much knowledge as we can. And about the long-term side effects, see, we do know that there are short-term side effects, but we also know this much, that there are no life-threatening long-term side effects. That is why the vaccines were approved.
Geoffrey,
that much we don't. It is wrong.
Geoffrey, I just want to ask you, I mean, the perception of COVID itself. Obviously, we at Al Jazeera have been covering that story for ever since it began, well over a year ago. The images that come to me predominantly are of crowded ICU beds around the world, of health staff, medical staff under tremendous pressure. But the stories of individuals being affected, the way that COVID actually affects the individuals, are far fewer. Those images are not as strong. Do you think that that has an impact on the way that people perceive COVID and subsequently, therefore, perceive the need to get a vaccine?
I do. Often, when medications or vaccines are promoted, we tell individual stories. Here, it's really been the story of protecting the health system, protecting society. But we need to emphasize that individuals have been greatly affected. Long COVID is a very serious issue. And I think it's important now to start telling the story of what it's like for people who are on respirators, who are spending 2, 4, 6 weeks or longer in a hospital, the impact on them personally, on their life and on their families. And there's thousands tens of thousands, hundreds of thousands, and now millions of individual stories, and those aren't well known. So people feel that, well, it might not affect me, or it'll only be light symptoms or a couple of days where it's difficult to breathe. But while we do know that most long-term effects or serious adverse events for a vaccine occur very early on, what we don't know is the long-term effects of having contracted COVID. And I think that's a story that really needs to be told and emphasized.
Samantha, we're hearing that the Polish health minister is just saying that he doesn't recommend using the Chinese COVID vaccine at the moment because of a lack of data. How much do you think that stereotypes and geopolitics play a role into the apparent effectiveness or acceptance of certain vaccines?
I think those stereotypes are playing a role. But on the other side, I think having data been made openly available, especially through peer-reviewed publication and other ways of making this information widely accessible, will increase the trust in the vaccines that are coming out.
Chettri, Deepsikha was saying earlier on that one of the problems that she faces in India is the fact that not everybody has access to the internet in much of as in other parts of the world, and therefore getting information, reliable information, can be very difficult. It tends to rely on word of mouth, which presents an enormous problem, isn't it? Because you're relying on people's assumptions about the vaccine rather than the actual data that Samantha was just mentioning there. How do you get around that? How do you turn that focus onto the reliability of the data and away from hearsay?
Well, we really need a massive campaign, and this needs to be led by the government and its health authorities. And that means reaching every home possible, with letters, with pamphlets explaining the vaccines and explaining those that have been approved by the regulatory bodies, that they are safe if they've been approved, that there won't be long-term effects other than protecting you against the virus. So it's really about a grassroots campaign, but led by the government and all of the healthcare professionals possible. So doctors, nurses, other healthcare professionals explaining, but it's really about reaching people at home. It's about having government officials and other health officials on TV regularly, in the newspapers, explaining this, particularly to those, as you mentioned, who don't have good access to the internet or other kinds of technologies.
Deepsikha, obviously that is something that you agree with, but I understand that in certain parts of Asia, of course, there have been health teams who've been attacked when they've attempted to go into villages. It's certainly, at least in the early stages, when they've been trying to disseminate this information, people have been very suspicious. That is putting, again, health workers at the centre of this and at great risk. And it's a balancing act, isn't it? Trying to get the information out and how important that information is, but at the same time, not risking the lives of the health workers.
See, what I feel is at this juncture, health workers, whether it comes to treating the patients or propagating information, we play a very major role. And it comes with risks, but also if the information comes from us, people will automatically assume it to be more accountable. So I feel it is worth taking the risk because it is for the greater good. And right now, since we are talking about the propagation of vaccines, I would like to once again state on international media, quoting my guru and the god of modern medicine today, Dr. Fauci, that we need at least 75% of the global population to be either infected or vaccinated in order to develop herd immunity. So we also need to put it across that it is not only for you as an individual to be protected from COVID, but it is also more of a social responsibility. We are being part of history as it's being written, and now we have a chance to be a part of the cure by participating in the vaccination drive and by helping us develop herd immunity. So it is also a social responsibility, and this information also needs to be instilled in the minds of people so that they become more accepting towards the idea of vaccination as a whole. And this information coming from healthcare workers, of course, is going to be taken in with more accountability and trust as compared to others. So I feel, yes, there is risks. There are a lot of side effects and cons that we will have to face, but we should go ahead and do it with bravery and courage because it is for a far greater good.
Samantha, there are parts of the world, of course, which are limited in the number of the alternatives of vaccines that they have available to them, and therefore they're restricted to just taking the vaccine that they're being given by the government. There are other parts, of course, which do have this variety, which is allowing people to delay making a choice or making a choice to delay getting the vaccine because they don't like one vaccine, as it was perhaps happening in the early days in France. They prefer to take another vaccine. What are the risks, though, of having that choice become a negative when people are delaying and delaying because they don't get the vaccine that they actually want, and yet COVID is still marching on?
I would echo what everyone has been saying in that the best way to protect yourself and also bring an end to the pandemic will be to accept the vaccine that you're offered. And with the new variants that are coming up, this is the best way that we can protect ourselves and everyone else by really picking and choosing and trying to decide which is the best vaccine will only delay that and will cause us more problems in the future.
Jeffrey, as Deepsikha was mentioning there, Dr. Fauci in the US has said that a minimum level of 75% is needed in order to be able to ensure that we're on top of COVID-19, certainly in the US, but obviously across the world as well. What are the risks, do you think, that enough people are going to hesitate to take a vaccine or indeed not take a vaccine at all, that we may not reach that 75% point, that in fact we are going to elongate COVID-19 for a much, much longer period of time?
Well, right now, I think there's a serious risk, but I think there's even a bigger risk, which is that we need to reach that 75%, maybe even 80% of population vaccinated, so-called community or herd immunity, as quickly as possible because of the emergence of new variants. And right now, those variants are being relatively controlled by the vaccines, except for the variant observed in South Africa. So if new variants emerge and there's resistance to the vaccines, we have a serious problem. So we need to reach that 75, 80% very, very quickly. And right now, the global data, most studies are showing that there's a good likelihood that we will reach that percentage. But that hasn't been studied in all countries, and we already know now that there are equity issues with high-income countries getting vaccinated faster than low-income countries. And while I understand that, particularly now where the numbers are so low, so I'm in the European Union and most countries haven't even vaccinated 5% of the population, so it's hard to imagine passing on vaccines to low-income countries. We also need to remember that if variants emerge in those countries because no one is vaccinated and they start to spread, we go back to having to vaccinate everyone again or have boosters and so on.
Deepsikha, do you think that there is a tipping point at which governments will be forced to make it mandatory to take any vaccine that is available? And what do you think that tipping point might be?
If at all there is a tipping point for this particular thing to make one particular vaccine mandatory, I think that would be unethical in my viewpoint, because the world which we live in, people have the right to choose, but then they should choose responsibly. Like you mentioned before, they cannot keep on waiting for the vaccine of their choice and delay the entire vaccination process. But yes, if at all new strains are emerging, and then if resistance starts to develop, then yes, government can put a cap and they can stop the privatization of vaccines and make it a nationalized program. And then that is the only tipping point on the condition under which the government can make a certain vaccine mandatory. The privatization of vaccines need to be stopped. That is the only way. Otherwise, it is a completely unethical thing to do so, to impose a certain vaccine, a certain company's vaccine on the public. But yes, like Jeffrey mentioned, if we reach the juncture of resistance, then we will not have any option. But we need to do it in an ethical manner. That is what it is.
Samantha, it seems from what all three of you are saying that the fundamental problem is in the messaging, that the people are looking at the wrong thing and the media is basically propagating that. We're looking at the wrong figures. As we mentioned before, we should be looking at the hospitalizations and the death tolls, not the efficacy rate. If we are not going to get to a point where governments are forced to make taking a vaccine mandatory, what incentives do you think people could be offered in order to encourage them to take the vaccines?
I think there's already been some incentives that are being offered by the private sector. So being able to travel, some airlines saying that they will ask for vaccination before taking a flight. And I think also certain venues and events will be asking for vaccinations. So it could be the case that there is not even the need for the public sector or the government to enforce vaccination, and it's going to come about through those private interventions.
Chettri, do you think that there's a risk that if that does happen, then we're going to end up with essentially a two-tier society when it comes to vaccines, and with the potential that that could create rifts within communities and rifts within societies between those who have not taken the vaccine for whatever reason and those who perhaps might be regarded as more privileged who have?
It may in the short term, so I'm optimistic. I hope there's an end in sight. So it may be that for the next year or year and a half, there are limitations like Samantha, described. These could be venues for concerts. This could be entering a country. It could be travel. It could even be attending school in person. So there will be some decisions for the public sector to make as well. But then I hope ultimately that we will, eliminate the virus, and then we will go back to an issue where that's not as relevant because there won't be very much virus in the community to transmit anyway.
Samantha, how much does politics play a part in this? Because one of the issues that they had in France with AstraZeneca was that President Emmanuel Macron had originally voiced concerns about the effectiveness of the AstraZeneca vaccine for people above 65. That situation in France has now been reversed, but how much of an impact does the way that a politician approaches this have on whether or not people do get injected?
The politicians are having a huge impact. I think they have to be very careful about these kind of statements that are being made, because it will affect behaviours, and then it's very hard to reverse once you have said something. In that particular example, I would say that misreporting didn't help the situation, and the media should also play their part in making sure that the stories they publish are accurate, and it's not enough to go back and correct misinformation that's already got out there. It has to be checked and clear and accurate information to begin with.
Deepsikha, I understand that Prime Minister Narendra Modi got injected himself, and I think that was with the Covaxin virus. Did you notice a significant difference when he did that in uptake?
Yes, of course. Like in a country like mine, we are heavily driven by politics. Heavily, as in a lot of influences there in my country. So, as soon as my Prime Minister Narendra Modi got vaccinated, there was a huge surge of people tweeting about it, posting pictures about it. And along with him, even the nurse who vaccinated him, even she gained fame overnight. So the influence is huge. And I feel that is the kind of social responsibility that lies on the politicians to propagate the vaccines, because what they say stays in the media and it stays there for good. So, it is, I do agree that it has a huge impact. And like Samantha was talking about incentives, I would like to add that in India, when we were discussing and when we were trying to counter family planning and our huge population issue, we have started giving incentives, monetary incentives for people who agree to surgically sterilize themselves, males and females. So we are in the process of implementing the same where vaccinations are concerned, to give monetary incentives to the people of low economic strata in order to increase the compliance. Because in a developing third world country like ours, people will not hesitate to go and take any kind of injection, for that matter, if they are getting some monetary benefit in return for it. So, we should try new innovative ways in order to increase the compliance.
I want to thank all our guests, Samantha Vanderslott, Chettri, Lazarus and Deepsikha Chettri. Thank you too for watching. You can watch this and all our previous programmes anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. We are at AJ Inside Story. From me, Rob Matheson, and the whole team here. Bye for now.